All right, let's jump right in. We're talking about something pretty critical today. How do we oversee research in AI and digital health? These tools are evolving so fast that the old ways of doing things, well, they just can't keep up. We need a new playbook, one that lets innovation happen but keeps everyone safe.
So to really get this, you have to see the contrast. Think about traditional research. It's a straight line, right? You start small in a lab, maybe test on animals, and way down the road, you finally get to people. AI development, it flips that script completely. It starts with human data right from the get-go. And it's not a straight line at all. It's this constant loop of training, testing, and tweaking. And that mismatch, that's where things get messy. It's like trying to shove a round peg into a square hole. The old linear review processes just weren't built for this cyclical, iterative world of AI. It causes delays, frustrates researchers, and honestly, it creates new kinds of risks that the old systems just aren't equipped to handle.
So, that leads us to the big question, really the core of what we're talking about today. How can we possibly support this incredible cutting-edge AI research while making absolutely sure we're holding up the highest standards of safety and ethics for the people involved?
Okay, so here's how we're going to break it down. First, we'll look at the dilemma itself. Then we'll walk through a really smart three-stage solution. Stage 1, the foundation, then stages 2 and 3, where you build the evidence. And we'll wrap up by talking about why this whole framework is such a big deal.
All right, let's get into the solution. It's a modern, adaptive, and risk-based pathway. And the idea behind it is actually pretty elegant. The level of oversight should match the stage of the project. Simple, but it changes everything.
This three-stage framework was developed by Tamiko Eto, and that's pronounced Tamiko Eto. What it does is give a really clear, predictable roadmap for everyone involved. The researchers building the tools, and the review boards, the IRBs, whose job it is to make sure the work is safe and ethical. So let's look at the structure. It breaks down the entire AI development journey into 3 distinct stages. You've got your proof of concept, then you move into pilot and validation, and finally, you get to deployment and monitoring. It brings a lot of clarity to a pretty complex process.
All right, let's dig into stage 1, the foundation. This is all about discovery and ideation, and it's so important to get this right. This is where the entire scientific foundation for the project is built.
So, in this first stage, the goal isn't to build the final tool, not yet. The real objective is to establish a clinical association. That means researchers have to do their homework, digging through literature reviews, checking professional guidelines, and analyzing existing data to prove there's a real, scientifically sound connection between their idea and an actual clinical outcome.
Okay, now this is a really crucial point. In stage 1, the administrative burden might be lower, but we have to be clear. That does not mean there's no risk. In fact, the data being used at this stage is rarely de-identified or anonymous, so there are significant foundational risks here. This is the stage where the scientific validity and quality for the entire project are set in stone. If you get this part wrong, everything that follows is built on a shaky foundation.
And a huge piece of that foundation is something called the intended use statement. It might sound like jargon, but it's incredibly important. It's a single sentence that clearly defines what the tool will do, who it's for, and in what setting. And that one sentence, it literally dictates the entire regulatory and ethical path forward.
So, moving on from stage 1 isn't automatic. To get the green light for stage 2, the team has to go to the review board, the IRB, and show their work. They need to present valid evidence of that clinical association we talked about, and they need a clear, well-justified plan for how they're going to use the data. Only with that approval can they proceed.
Okay, on to stages 2 and 3, building evidence. Now we're moving from the foundational concept to actually validating and investigating the tool.
So stage 2 is all about validation. This is where you test the tool itself, its accuracy, its reliability, its precision. You throw new data sets at it to see how it performs. Then, if it passes muster, you get to stage 3, investigation. This is where the tool goes into a controlled, real-world clinical environment to test for safety and effectiveness.
And this image really captures the whole idea perfectly. It's a building block approach. Each stage layers on new protections and new evidence. You start with human research protections, or HRPP, then you add on good machine learning practices, GMLP, and quality management systems, QMS, as the project gets more mature. It's a logical, step-by-step way to build trust and rigor.
And it's really important to see that this framework isn't just for medical tools. It's flexible enough to be a model for all kinds of research. Think about social, behavioral, and education research, or ESPER. This staged approach provides a powerful pathway for developing AI ethically in those fields too. So, let's talk about why this framework really matters. Because it's not just about a new process. It's about strengthening protections for everyone.
You know, when you break it down, the benefits are pretty clear for everybody. For researchers, it provides a predictable path forward. For the IRBs doing the reviews, it offers a solid risk-based model. For participants and patients, it makes sure the protections actually match the level of risk. And for the public, it helps build trust that innovation is happening responsibly.
And it all comes back to this one guiding principle. Make the right thing the easy thing. It's about designing a system where doing things ethically and safely is also the most straightforward and efficient path for researchers, reviewers, and institutions.
And I want to make sure to note that this three-stage framework was a collaborative effort. It was co-authored by Tamiko Eto, who we mentioned earlier, along with Dr. Mark Leifson and David Vidal, JD. So that kind of leaves us with a big, important question to think about. As AI becomes more and more a part of our daily lives, how can adaptive frameworks just like this one make sure that all this amazing technology actually serves humanity, safely and ethically?